As parents, we are constantly observing our little ones, trying to understand their every signal. When you see your child tugging at their ear, a little alarm often goes off, doesn't it? It is a common scene that can quickly lead to worry. But here is some reassuring news. Ear pulling does not always mean your child has an ear infection. In fact, many times this behavior is a completely normal part of their development or a sign of something much less serious than an infection. Understanding the anatomy of a child's ear is key here. Children have eustachian tubes that are more horizontal and narrower than in adults, which can make them more prone to fluid buildup and infections. However, when your child pulls their ear, it could be for a variety of other reasons. For instance, teething is a very common culprit. The pain and pressure from new teeth erupting can radiate to the jaw and ear area, causing your child to pull or rub their ear for relief. They might also pull their ears out of simple curiosity. Babies and toddlers are exploring their bodies constantly, and ears are an easy target for little hands. Sometimes, ear tugging can be a self-soothing mechanism, similar to thumb sucking, especially when they are tired or sleepy. Think of it as a comfort habit. Dry skin or eczema can also cause itching around the ear or in the ear canal, prompting your child to scratch by pulling. Even a buildup of earwax can feel strange or itchy to a child, leading to them pulling at their ear to try and relieving the sensation. Allergies, which can cause congestion and pressure, might also lead to ear discomfort without a full-blown infection. So how can you tell the difference? The key is to look for other symptoms alongside the ear pulling. If ear pulling is due to an infection, it will almost always be accompanied by other signs. These can include a fever, irritability, difficulty sleeping, decreased appetite, or drainage from the ear. If your child is pulling their ear but is otherwise happy, playful, and eating well, it is likely not an infection. Pay attention to how often and how intensely they are pulling, and if it seems associated with specific times, such as bedtime or when they are hungry. An interesting detail about ear anatomy is the presence of the tragus, that small piece of cartilage in front of the ear canal. If pressing on or wiggling the tragus causes pain, it is often a sign of swimmer's ear, an external ear infection, rather than a middle ear infection. Middle ear infections, known medically as otitis media, are much more common in young children and usually involve fluid behind the eardrum. Knowing the difference between the external and middle ear can give you a better idea of what might be happening. By being observant of your child's overall behavior and looking beyond just ear pulling, you gain valuable insight. You will feel more confident distinguishing between a harmless habit or minor discomfort and a situation that truly warrants a call to your pediatrician. This understanding empowers you to respond appropriately, providing comfort when it is needed, and seeking medical advice when necessary, ensuring your little one receives the right care at the right time.